Dr. Sorry, Dr. Angelo, look, stage fright even happens to me sometimes. Dr. Angelo McClain, he is the Chief Executive Officer at the National Association of Social Workers in Washington, D.C. So we want to thank him for traveling here during his very busy schedule today to Delaware to come, and he will actually be, later on we'll get to hear him speak. He wanted to, one of the things he takes great pride in is being able to tell his story, starting off as a social work student at the bachelor's level and moving through to becoming the Chief Executive Officer at the national level. So I want to start off, so we'll call the meeting to order. And I think we have someone taking minutes. Pardon me. So I just want to start off with my President's report. So once again, welcome to this board meeting. We are glad to report that NASW is on the move. We've been working with the Delaware Board of Clinical Social Work Examiners and the Delaware Division of Professional Regulations in a continuation of our efforts to achieve multi-tiered licensure for social workers at the BSW and at the MSW level. As social workers, we provide a critical service in the protection of the public health. As we move forward with this initiative, we look forward to members and non-members, students and faculty alike in their participation in protecting the social work field while raising the level of respect and visibility of social workers as a part of the system of health and community care. We will be conducting, so you'll want to look for this on our website, we'll be conducting town hall meetings, surveys, and also, and of course, accepting feedback to allow the voices of social workers at every level, student, bachelor's level, master's level, license, and faculty, to have their voices heard in our continuous efforts to move the profession forward. As we talk about public safety, there are several issues in which we must be concerned. Violence in our communities, safe and affordable housing, and care for our individuals and communities across a lifespan. While the reports of violence across the state demonstrate a reduction in violence, in the city of Wilmington, in certain communities, violence rates continue to rise, well above the national average. The NASW is working with the Wilmington Police Department and the faith-based community, particularly Churches Take a Corner, to develop training for police officers, professionals, and community members to bring awareness and skill with a focus on best practices in law enforcement and community engagement. The purpose of this is to forge healthier and ongoing improved relationships between law enforcement, professionals, and those whom we serve, the most vulnerable in our community. The chapter is also working with legislature and other professional groups towards rectifying the problematic outcomes of the housing crash several years ago, which disrupted safe and affordable housing for Delaware residents and businesses. I learned this afternoon that in the state of Delaware, a small state that we have with only approximately a million people in the state, that 3.2% or 32,000 people are still without homes as a result of that housing debacle. That's a large number for a very small state. And we need to continue to work as social workers to, as well, there's been $1 million, I believe, that was provided to address that issue, and not one dime of that money has gone to any of the residents of our state, the citizens of our state who have been displaced in that process. So social workers, we have a lot to do. As well, the NASW continues to develop and support continuing education courses which improve the service delivery of social workers to the public, including a training coming up on October 9th in Dover. That will be the Trauma Art Narrative Therapy. Anyone interested in working with traumatized people, working with young people using creative and art integration and therapy would want to come to this workshop. It is going to be an excellent workshop, and it'll be conducted by Dr. Bills. As well, NASW and the NASW is partnering with the National Alliance on Mental Illness, more commonly known as NAMI, for their annual conference. The conference this year, the theme of the conference is Inspiring Hope. And, with a focus on inspiring hope for people who live with mental illness, but also those who care for them in a direct and indirect way. It's a very important conference, and so we're really proud to be able to have that partnership with NAMI and that organization. As well, and this is a significant note, we are offering year-round test prep for folks who are looking to take the licensure exam. One of the things we recognize at the NASW is that we want to make sure that we are a part of that preparedness system that provides students at MSWs who are moving towards licensure with being able to have all the tools in their toolbox to achieve that goal of passing that licensure test. So we will have those dates are posted on our website at NASWDE.org, and you may go to visit that website to see when those offerings are going to be, see when those offers are going to be best fit for your schedule as far as taking the licensure exam. Also, NASW is accepting workshop proposals from social workers and professionals across the region to enhance and grow the types and numbers and content of our continuing education workshops offered throughout the state. The focus on this and the importance of this is that we want to have our social workers, our licensed and experienced social workers, be a part of that sharing and that giving back to other social workers who may not work directly in their specific field of social work, but may have curiosities, may be moving into a new field within the social work profession, and may want to, rather than waiting for experience to be their teacher, to have an opportunity to have some academic exposure, as well as for students who may be inquiring as to what focal area they may be looking to move into in the field of social work. As you know, social work is a very broad field. Social workers are everywhere. We're in the courthouse, we are in clinics, we are in hospitals, we are in state and federal government, we are everywhere. And to be able to take a workshop and learn about how other social workers are applying their clinical skills in those areas can be vital in helping you shape and continue the development of this profession. As you all know, thank you all once again for coming. Our meetings are every third Thursday of the month at 6 p.m. So although this is one of the meetings, we have a special meeting today, and all were invited, and some special guests were invited. Please know that the NASW board meetings are open to all members, and you are welcome to come. Your voices, once again, are needed to be heard, as well as the NASW also has a variety of volunteer opportunities for social workers. One of the key values, one of the key principles of social work is service. One of our key core values is service. And service begins often with giving back, not in faraway places, but giving back in your own backyard. So we have several committees. I'm not going to list them all. Membership is one of them. Continuing education is another. We have a PACE committee, a political action committee, a variety of committees that people may be interested in, both as students and as graduated social workers, where your volunteerism is much needed, as well as greatly appreciated. So please check out our website once again to find out those opportunities. Also, please, if you have not signed up for the NASW newsletter, please do so. The NASW Delaware and the national newsletter, please do so. It is only through, social workers don't have a lot of tools. We don't carry guns most of the time. We don't carry shields. We don't have a lot of weapons. One of the key weapons that we have is our knowledge about what is happening and our ability to communicate it. And so we want to be able to do that in effective and efficient ways, but also we want to be able to be accurate. And so gathering the information, information has been gathered for, so the great thing, particularly for anyone of us who's had to take research, is that it's nice to know that someone else has already gathered the information for you. All you have to do is read it. So please check out our website and our newsletter and the national newsletter to learn about what are key and priority events in the social work field. Finally, I just want to close by saying I want to acknowledge the board of the NASW. If any board members who are present, if they could please stand up so they could be seen. Okay. So we have Vicki Root, our vice president, Bianca Ranger, our Sussex County rep, Deborah, our transitional advisor, and we have Nadia, who is our MSW rep. We have several other, oh, you can stand up. And Sancho, who is our our BSW representative. So for students, particularly, these are the social workers that you want to be going to have your voices heard. And also, if you have questions about the NASW, they're easily accessible persons to speak to. Yeah. So I want to, Dr. Austin, I wanted to ask if you could come up and give a welcome from Dell State, please.
Yes, sir.
Very good. Should I mention I'm a DSU graduate? I'm an alumni. All right, thank you.
Mr. Coleman, good thing for those of you who are students, I don't know if Mr. Coleman indicated that he's a graduate of our program. So for you students, this is where you'll be 5, 10 years from now. You'll be the next CEO for the state chapter, right? Come on, Fatima. All right. Okay. This, as I indicated in an earlier meeting, this has been not necessarily the best day for us to host and to collaborate with NASW to bring the national executive to campus, because today is also the same day that the Board of Trustees are meeting on campus. And when the Board of Trustees meet on campus, the administration building is pretty much shut down, and you can't get any of the, you can't get the president, the provost, the COO, or any of those folks out of that building until they have, I guess, figured out how they're going to complete financing the remainder of the academic year and make sure that this institution has a future. So they leave it to those of us who are not in the upper tier to come and bring greetings and salutations to our guests. So I would like to extend to all of you, our alumni. I see a whole bunch of our alumni in the audience, the board members of NASW, the members of NASW, to Delaware State University. And of course, on behalf of the Board of Trustees, the president, and the provost, to welcome Dr., you know, we never got that title right, but McClain, Angelo McClain, to Delaware State University. In addition to the audience that we have here, This meeting is being streamed at 2 of our additional locations, one at our Kirkwood location in Wilmington and one at our Georgetown location in Sussex County. So I just got a text message that the streaming is not going real well right now for Wilmington. So I will kind of follow up on that as the evening progresses to make sure they're getting the signal properly. But again, for the second time today, we welcome you to our campus and to chat with our community, our students, our alumni, and the State Board. Thank you for coming.
Sure. I was going to read your bio.
Oh, go right ahead.
You want me to read your bio?
Yeah, go ahead, I'll stand here
It's
while
a
you do
wonderful
it.
bio.
We'll work it together.
Excellent. You correct me on any mistakes that I make. Okay. Well, once again, NASW Delaware welcomes Dr. Angelo McClain to Delaware State University and to the state of Delaware in support of the Delaware chapter of NASW. His bio reads, Angelo McClain, PhD, LICSW. He's the current NASW Chief Executive Officer. On March 7, 2013, the National Association of Social Workers named Angelo McClain its new Chief Executive Officer to lead efforts that grow and support the social work profession in the United States. He succeeds Elizabeth Clark, PhD, who led the organization since 2001. Dr. McClain joins NASW after serving 6 years as Commissioner for the Massachusetts Department of Children and Families, a position appointed by Governor Patrick. While there, he oversaw a budget of $850 million and a workforce of over 3,500 employees to address reports of abuse and neglect for the state's most vulnerable children, partnering with families to help them better nurture and protect their children. Prior to that position, Dr. McClain was Vice President and Executive Director of Value Options New Jersey, where he built and oversaw administrative, clinical, and quality management program infrastructures that increased access to behavioral health services for children and youth, including those children in the juvenile justice systems. As Vice President of Network Management and Regional Operations for the Massachusetts Behavioral Health Partnership, Dr. McClain developed and maintained a provider network capable of delivering high-quality, responsive services to 450,000 Massachusetts health members. Dr. McClain grew up in Texas and is a distinguished member of Cal Farley's Boys Ranch. He holds a bachelor's in science and social work from West Texas State University, a master's of science in social work from the University of Texas in Arlington, and a PhD in social work from Boston College Graduate School of Social Work. He is an adjunct faculty member in the Urban Leadership Program at Simmons College Graduate School of Social Work. He has received multiple honors, which I will not read, and done multiple presentations around the world. Actually, earlier today, he had just mentioned that he had just recently, he's traveled now 35 states in this country, just doing work with the NASW in his short tenure. So we thank him, we welcome him, and look forward to hearing more from him today.
Thank you. That was a long introduction. But this mic is working. So how's everybody doing? Very good. I've had Delaware State's going to be on my list of favorite schools of social work. They've really had a chance to be here all day, mostly all day, and meet with a number of different folks, meet with faculty, meet with some of your partners from the community, and Thank you for setting up a really rich opportunity to come and spend time with you. Very warm welcome, and just some really good, great discussions about, you know, how can we as a community, as a School of Social Work, as a chapter of a professional association, and as a community, how can we do what we can do to make the lives in the communities that the clients live in better? And it's just really, really rewarding for me to be able to participate in some of those discussions. I'm not sure what you heard, like when you heard I was coming, like if there was anything you were hoping I might talk about. I can talk about a whole range of things, but let me just ask that question. When you heard I was coming, what were some things you thought you hoped I might speak to? This is a real quick exercise. Expectations. What do you hope I talk about? Yes. License exams? Okay. What about licensing exams? Okay. What else? Yes. Social work best practices. Any particular areas? Okay. What else? Somebody could give me something easy. The dues? What else? Okay. What else? When I do this exercise, I always get 9 suggestions, and we're up to 4. Not too any pressure. Anything else?
How are changes at the national level impacting social work and public health in this session?
Okay. Anything else? Okay. Okay. We're up to 8. Oh. The implication for social work in ending racism? Okay, we got 10. Oh, no. This will be the 10th one. You're number 10. Okay. Oh, is that her hand back to back? Yes. Social work salaries, is it expected to increase or decrease? All right. I'll jump in. It's going to take all of us to answer these questions, because you guys didn't give me any easy questions. These are all sort of complex, so some of these I can jump into and answer, and some I'm going to need some help with. Is that okay if we do sort of a group kind of thing to make sure we get you the right answers? What I'm really good at is inspiring people and motivating people. As you can, and I think we're talking about, I had a staff of 3,500 employees when I worked in Massachusetts, and 2,500 of them were social workers. And so, my job was to be the head cheerleader. I just went around into the offices. We had 26 offices. I just went around to the offices and just go, 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 rah, rah, rah. And as I've taken on this job, I find out that, my primary job in this role is to be the head cheerleader, is the rah, 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 go, go, go. I have met so many social workers across this country, and I just take my hat off to, the dedication, the commitment, the passion, the skills, the discipline to do the right thing, in an evidence disciplined kind of way, to go the extra mile. So I just cheer, and that head cheerleader coin, there's two sides of the coin. One side of the coin is really cheering all of us on, and the other side of the coin is making sure that people in high places know about the good work that we're doing, whether that's on Beacon Hill in Massachusetts or on Capitol Hill in Washington, D.C. It's to really beat the drum for social work, to say social workers are out there doing incredible, amazing things. And a privilege to be able to hold that position. As Nora was given my background, one of the things he talked about was that I was a resident of Cal Farley's Boys Ranch, just outside of Amarillo, Texas, from the ages of 13 to 18. And thank goodness Cal Farley's Boys Ranch existed, because I was getting into some juvenile delinquent kind of activities, and who knows where I might have headed or wound up. And I was there, basically something you might consider a residential group home. And I thank the social workers and the counselors who were there and were patient enough with me to help me through those first 3 years, because the first 3 years I was not with the program. I struggled against it, I fought against it. I didn't want to be there, but the last 2 years I said, I might as well try to make the best of this and make the most of it. So I went through that, and as I was leaving there, I thought, these people have been really good to me, they've helped me. I don't know if they've saved my life or not, but they certainly have put me on the right path. And the best way I can say thank you to these folks is to go out and make something of myself. And I know as I travel across the country and internationally that I may be the only person someone might meet from Cal Farley's Boys Ranch. And this is an institution that's been around since 1939. And they served over 10,000 young men and women who've lived on their campus. So it's one of the major child serving institutions in this country. So I do feel an obligation to represent. And I also feel an obligation to represent the schools I've attended. And hopefully when you leave, is it DSU? As you leave DSU, you will feel that obligation to represent, because I've just from the small amount of time I've been here, say, hey, this is a place where you can get a really good education, where you can get some tools. And I'm speaking to this young man here. What's your name again? McKell. And just, we're talking about his placement and some of the things about what he's thinking about doing at a macro level and a micro level, and sort of his systems thinking. It's like, you can tell he's had some good schooling, because you just don't come up with that on your own. That's taking the lesson seriously and being able to apply it and think, not only apply it to the clients or the communities, but how do you apply those lessons to yourself, and how you think about where you fit. So that's good stuff. I've been fortunate throughout my career to always have jobs I loved. You know, when I first got into social work, there was a lot of talk about burnout, and I was concerned I might get burned out. So I think, well, maybe I should kind of proactively think about, am I eating right? Am I getting my sleep? Am I dealing directly with the issues that are confronting me? Am I being nice to this is the most important one, am I being nice to my loved ones? Am I giving them unconditional love? So when I need their unconditional love, they'll be there for me. And all those things. So I've never really experienced the burnout that people talked about. But I know part of it is because I've taken care of myself. Part of it is I've prepared myself well. So there aren't many situations that I get into that I have not had some experience or read a book or attended a class or talked to a colleague about and find a way to manage that situation. So I really would stress to your students, learn as much as you can, be a sponge, be a sponge, be a sponge. Soak it up, because that thing you learn on a Thursday afternoon at 2 o'clock or at 4 o'clock when the class is almost over, that might be the thing that helps you help a family. That might be the thing that helps you make a better assessment, whether it's a dangerousness assessment, a risk assessment, or just an assessment. I was talking to, I don't see her now, about one of her clients in a nursing home. There you are back there, and she was saying, she did an assessment, and people were saying she stopped eating, and so folks we're going to translate that into a psychiatric issue, but she went in and did an assessment. It wasn't a psychiatric issue, it was a oral health issue. It was about her teeth were hurting. So you never know when that lesson at the 11th hour in that class might be the lesson that helps you. And the other thing hopefully you're figuring out is, the lessons you learn today, a lot of what you're learning today is going to be obsolete in 5 years. Like some of the ways of doing things that we think are cutting edge today, in 5 years they won't be cutting edge. That's okay. Because what you're learning here, you're learning how to think, you're learning how to make critical judgments, you're learning how to understand things, and you're learning how to get new knowledge. And I hate saying it, I remember when my professor used to say it, I cringed, but learning is a lifelong commitment. When you get to be my age, there can be things you knew that you forgot, and that's okay. But really, jumping in there. Social work best practices, particularly related to for me, social work best practices, I think that we should try to discipline ourselves. I mean, we've had this discussion, is social work a science? Is it an art? Is it both? I think social work is a science and an art. I mean, sometimes folks will say, well, you've got to be there kind of an experience. A lot of what we do is improvisation. It's improvisation, but it's improvisation based on some really good knowledge, and we have a really good knowledge base. But we really do want to be practicing with evidence, because there's an ethics issue there, there's an equity issue there, and then there's sort of a, optimizing your time with families and with communities. And we need to understand what works for who. So we really need to be in systems and helping build systems where we're collecting data and we're making decisions based on data. And we all have a responsibility. I mean, sometimes we'll go into situations in agencies and there's a robust data system there and there's all these reports that get cranked out, and other times we'll be in systems where there's barely anything. Whatever we have, even if we got to, tally it up on a control sheet, to actually be keeping track with data, and be asking questions with data. Like, for instance, from a cultural competence perspective, what works and what works for whom? And or when we look at the outcomes we're getting, are we getting outcomes across the different segments? Just to give you one quick example, in the child welfare, we were looking at removals of children coming into foster care. And we were looking at white kids, Hispanic kids, and the African-American kids. 30% of our white kids who come into foster care were being placed with relatives, and only about 18 to 17% of those other two groups. And we begin to say, well, why is that? And we begin to unpack it, we begin to say, well, it's because of institutional racism. When you look at our standards and policies about each kid's got to have a separate bedroom, that bedroom's got to be so many square feet, you got to have this, this, and this, and you're saying, well, and you can't have any criminal background, and you begin to say, well, when you look at the policies, the deck is stacked against families of color. We have to, and this is like an agency that had an African-American commissioner and a Hispanic deputy. So we're saying, why are we getting these numbers on our watch? And it's the institutional racism. It's the policies that were in place that we haven't changed. So we unpack those policies. And then we begin to have discussions with our staff and say, well, it's not just the policies, it's the headset of people. People are saying the apple doesn't fall far from the tree, or, that grandmother was a client. I remember her, she was a client before. It's like, well, that was 10 years ago. Do you think maybe she's changed? Or maybe we should go out and assess and see if they changed or not? But sort of from an evidence-based perspective is being able to practice with data. And then there's any number of, whether it's multifamily, systemic therapy, functional systemic, there's a lot of different models out there in terms of best practice, and to identify those best practices and to think about how can you use those with fidelity. Because sometimes people will be saying they're using some type of evidence-based practice or some type of manual-driven practice, and when in fact, they're not doing it with fidelity. So how can you get the training and the supervision for those models? In terms of the licensing requirements, I think what Delaware is wanting to do, or what the NASW chapter is trying to encourage, is having a multi-level licensure. We have 3 different levels of licensure, not just the clinical licensure level that you have now. And unfortunately, in the field of social work, when you go state to state, it runs the whole gamut. In Massachusetts, we have 5 levels of licensure. In Florida, there's 2 levels of licensure, and just go on and on. There's different levels of licensure. It makes sense that there'd have to be 3 levels of licensure, and actually the Association of Social Work Boards, in their model licensure law, they recommend 3 levels of licensure. A clinical license, a master of social work license, and then a BSW license. So hopefully you guys will be able to get that through. And it's really, when you think of licensure, when I first started thinking of licensure, I thought it was so as a social worker, I could distinguish myself that I've got this level of licensure. But then I learned later that licensure really is to protect the public. Licensure is really to be there so people who are practicing, that's one way of assuring at least some minimum level of competency. And as you know, our code of ethics, one of the things it requires is that we practice within the scope of our competence. That if we don't have competence in an area, we shouldn't be practicing in that area. We should refer those families to other folks. The member dues increase. How many show of hands have gotten a renewal notice and you see that there's an increase in dues? Okay. We decided to increase dues this year for a couple of reasons. One reason is we had not raised dues in 10 years. We went, and there were good reasons why we didn't raise dues over the last 10 years. We had the recession hit in 07, 08. Historically, every 2 or 3 years, about every 3 years, we would increase the dues. But with the recession, it was like, well, let's not raise them now. And then we began to look at it and said, we're about 35% behind the curve. If we look at where we could be compared to where we are, we should consider a dues increase. And we said, well, if we look at a very conservative cost of living over that 10-year period, what would that conservative cost of living adjustment be? And then we made our dues increase about 20% lower than that. And the sense is, we want a vibrant, national, local, professional association. In order to do that, we want to make sure that we support it in a way that it can continue. Because, the cost of doing business, you can't, whether it's a loaf of bread or a pair of jeans or just about anything, there aren't many things that are the same price that they were 10 years ago. And it's really, in some ways, it would be irresponsible if we didn't sort of periodically adjust the dues so we can do the things that we want to do in terms of advocacy.
I just wanted to ask, for the state smaller than Delaware, that's going to be a major hardship for a small state. I know nationwide, but if they consider the small states that are already struggling financially, that may fall, possibly lose membership?
We did in some ways, that's some of those considerations are why we didn't raise dues over a 10-year period of time. And we looked at some of those factors, and that's why we said, well, let's keep the percent as low as we can. And then we looked at some analysis looking at other professional associations similar to ours. And sort of what we found out was that we look back over a 15-year period, anytime we raise dues, there's some drop in membership, where there's 2%, oh, thank you, 2% or 3%. And usually that recovers itself within about an 18-month period of time. Now, interestingly, since we've announced the dues increase, our membership has actually gone up. And in Delaware, the membership here has gone up 7%. So we're still tracking and trending that. And one of the things we were intentional about, we did a strategic plan about a year ago. And part of that plan was we wanted to spend a year bringing on some new services and products and work at a national level and a chapter level, with a sense of, before we raise dues, we ought to improve the benefits of membership. So we've done that. For instance, we've engaged a lobbying firm at the national level that's helping us with our advocacy efforts. And we are very, very close. And actually, over a 5-year period of time, our federal advocacy capacity at NASW had basically was at zero. That just kind of fell by the wayside. And so we said, we got to restore this. We got to have a really strong federal advocacy piece. So we've restored that. And we're actually working with a couple of senators who happen to be social workers and the House of actually getting legislation filed that's going to raise reimbursement rates, Medicare reimbursement. Well, I shouldn't say it so boldly like as if it's going to happen. We're filing a bill, and then that bill's going to have to go through a process and hopefully can go into law. So there's many steps in the process. But what the bill seeks to do is raise the Medicare reimbursement rate for social workers. Currently, social workers are reimbursed at 75% of the physician fee schedule. That bill asked to push that to 85%. The bill asked that social workers, clinical social workers, be allowed to practice under their own license and to bill Medicare in skilled nursing facilities. And it also asked that the behavioral health assessment code on the medical side be available to social workers to bill. And the 3 very important things, and we think within the next 30, 60 days that bill's going to get filed, and there'll be a big announcement. And we do know that when we get the Medicare rates increased, that's a bellwether for that's a bellwether for Medicaid, that's a bellwether for managed care companies. So that gives us a leverage point for asking for increases other places. And we're also working around some of the public policy things that are very important to us, like achieving racial equity. We're doing a number of things on the locally and nationally to look at how can we further this discussion about achieving racial equity in any number of areas, whether it's healthcare, oral health, any number of things. When you look at outcomes, child welfare, incarceration rates, and really being able to push the needle on that. And we're working on a project of training as many social workers as we can who are wanting to be trained in a undoing racism course. It's a very intensive course that teaches how to work to become intentional about undoing racism. And one of the core pieces of it is a macro piece that looks at how can you go into a community and do a power analysis and look at all the systems, from transportation to education to health, jobs, housing, social outcomes, social service outcomes, to be able to see if you're getting the kinds of outcomes that you should be getting that we would expect. And where there are disparities, to be able to come in with tools to address those disparities. I should be checking these off as I go through them. The Accountable Care Act, it is being implemented. I don't know sort of what's going on here in Delaware. And I may be a little jaded because I come from Massachusetts and we had healthcare reform that was passed in 2006, quote unquote Romney Care. But I know nationally we are seeing the accountable care organizations, the medical homes and behavioral health homes. Those are in places. The exchanges are in place. And I think we've had probably about 20 million people who have gotten their insurance through the exchanges. So it's coming in stages, but it is being implemented. NASW is helping the social work profession look at ways that social workers we can maximize the role of social workers in healthcare reform. And I try to encourage people to think about, whether it's being patient navigators, care managers, clinicians, directors of programs, entrepreneurs, to think about healthcare as an opportunity to practice. We've got examples as in Idaho, and we've got a social worker who's running a clinic and that has probably about 12 different professions, whether it's psychiatry, medicine, physician's assistants, physical therapists, social workers, psychologists, as a business, as the entrepreneur running that business and making changes. And that clinic was of such significance in terms of the outcomes they were getting that they were the first site chosen in the country to, we talk about integration of behavioral health and primary care, and sometimes we talk about maybe locating behavioral health in primary care settings. This is the first actually going to take primary care and locate it within a behavioral health setting. And they got a national grant to be able to do that. I was talking to a social worker yesterday who was the head of a physician assistance program at a university and is also the president or former past president of the Physician Assistants Education Association, a social worker playing a leadership role with physician assistants. So there is, and about 25% of social workers practice within medical, the health settings. And when you think about social workers in health, in healthcare, and you think about, well, what determines and help impact better outcomes, it's the social determinants of health. When you look at those things outside of the diagnosis and the clinical things, transportation. Can a person get to their medical appointment? Can a person get to the pharmacy to get their prescriptions? I was in a cab the other day in DC, I was going to the Institute of Medicine for a series of meetings, and when I told the cabbie where I was headed, he goes, "Oh my gosh, let me tell you about my health care." And he was saying, I was on this medicine for my heart condition. I was having to go and get my blood drawn twice a week. They put me on this new medicine. I found out about this new medication. I only have to get my blood drawn twice a month, but my insurance company won't pay for it. I'm stuck. And I said, well, here's what you do with your insurance company. Here's who you talk to. And you let them know, here's how you can advocate so you can get that. So make sure they understand how this new medication impacts in a positive way your life. And as they understand that, they will approve it. So healthcare is right for us to be there. The Bureau of Labor predicts by 2022 there'll be a shortage of social workers in a number of areas. Healthcare, aging, child welfare services for veterans and military families. So one of the things we need to do is recruit people into the field of social work, for them to see that social work is a profession where you can have heart and passion, discipline and science, and you can, if you want to change the world, if you want to make a difference in communities, I mean, social work is a place where you can get that done, and be recruiting people into that. And there's a group called the American Academy of Social Work and Social Welfare. It's a long title. It's mostly academics and deans who are in the academy. And they've been working on something called the Grand Challenges for Social Work. And it's a takeoff of the Grand Challenges that was done about 10 years ago for engineering. And for engineering, they identified their grand challenges. I'll just give you some examples. It's really trying to say, what are some things that engineering can do to help society, and so people can understand what engineers do. And so they came up with clean air, clean water, safe bridges. So the grand challenges for social workers, what are those things and those big challenges in society that social workers can help reverse, address? And actually the grand challenges are gonna get rolled out in January. And these are things like ending homelessness, ending intimate partner violence, addressing issues of economic insecurity, food insecurity, issues of better health for all. So these are things that would resonate with us. And then what's going to happen after these get announced, there's going to be a really big public education campaign around these issues. So folks, just the average person, you know, we'd have marketing and commercials and advertisement up of talking about, here's what social work is doing to help our society. So people have a much better idea of what social workers do. And the other reason for doing it is so we can galvanize ourselves as a profession, that we're all pushing and moving in the same direction. And there's obviously one in there about achieving racial equity. I mean, obviously that's an issue of great importance to our profession. I can't read my writing. Oh, there was a question about what can be done to facilitate a better relationship between the chapter and the national office. And one of the things is having someone from the national office come out and see and hear all the wonderful things you're doing, so we can really get to know you. And the other thing is realigning ourselves within NASW, where the way we're structured allows us to more naturally work with each other. We've been undergoing a process in NASW where we've been asking ourselves the question, should we do some reorganizing and restructuring to where we can kind of modernize and revitalize the association? Can we do some things to better position us for the next 20, 30, 40 years? And we celebrate our 60th anniversary of NASW. NASW was started on October 1st, 1955. And I've actually had the pleasure of meeting a few charter members who were members on that day and have been members continuously for 60 years. In 1975, we went to a chapter, we went to a sort of an organizational structure where we had 250 chapters. And in 1955, we had 250 chapters. In 1975, we came back and said, that's too many chapters. You know, there's a lot of redundancy, inefficiencies. So we went from 250 chapters down to 56 chapters to sort of say, we'll go to more of a state model versus a sort of a district model. So NASW did an analysis about 15 years ago. We brought in a consultant, an expert in associations, and who did an analysis and basically recommended that NASW need to make some changes to organizational structure to remain viable and vibrant well into the future. Well, that report just sat on the shelf. And about 3 years ago, just prior to my coming on, the discussion began to say, you know, should we be looking at doing some things and to where we could, you know, reorganize, restructure ourselves. And part of it is, even though we're one association, we currently function as 56 different entities. We have 56 boards, we have 56 tax forms that we file, we have 56 audits. You know, there alone, if we restructured ourselves where we had sort of officially, one board that was responsible for the association, one tax form, one audit, we'd save hundreds of thousands of dollars with that one move. And then you look at that over time, it would generate significant savings over time. But kind of least of the dollars issue is really how can we better position ourselves to have more impact, more collective impact. And when you think that our chapters, on the one hand, it's brilliant that our chapters can be independent and can kind of have autonomy and local decision-making. So we were having this discussion, we're saying, maybe there's some back office functions that we can centralize, but still keep the autonomy at the chapter level. And we had a series of work groups. There's actually 3 work groups that did extensive work, spent hours and hours and hours studying the question, and came back with a notion that we should make some organizational changes, that we should preserve the chapters, that there's something about the local ability around programming, the local ability around membership, and the local ability around local advocacy that should stay at the chapter, and that decision-making be at the discretion of the chapter leadership. Because what might work in New Mexico might not work in Delaware. Or if you're working for multi-level licensure to get passed in Delaware, well, in Massachusetts, we've already got 5 levels of licensure, so obviously, the priorities are different when you go from state to state. So the model that was came up with was, let's preserve as much of that local flavor as possible, and then let's take the back office functions, those routine administrative things, and then centralize those things where we can take some of that burden off of the chapters and we can create some economies of scale. So we're actually in the process of implementing that. Our board approved a plan back in June to do that. And we're going to be taking the next year or so planning it out. I mean, there's one thing to have a plan, but then, as we always say, well, the devil's in the details. But we're going to take a year to sort through the details. The national staff, the national board, and the local leadership to be able to say, well, what makes sense? And we've actually established, one of the committees we've established is a chapter business committee is actually going to make sure that as we put the details together, that the details work from a chapter's perspective. And, excuse me for giving so much inside baseball into that, but I just wanted to give enough so you can understand. Yes, we are making some changes, and basically what we're trying to say is we want to have a strong professional association, and we need to reposition ourselves for the next 30 to 60 years. And we want a strong association, so when the folks who are in the 7th grade now, in middle school, when they come through, they'll have a strong professional association to work with. Sure.
Hopefully you saw a lot from your visit here in Delaware. I think we are proud of the work that we've done. So as we look at some of these modernization items that are coming up, how do you see a smaller chapter like ours? What do you project where we will be at the end of this road? There's big chapters, many chapters, we're surrounded by very large chapters, and we enjoy our autonomy. We enjoy what we build in on state chapters. So how does that fare both here on the East Coast as well as other chapters across the country?
I'm a read it. Well, one of the things that was decided was that we are committed to having a chapter presence. I mean, a number of different models we're looking at, or maybe we could go to a regional model, maybe we could have a partnership model, maybe we could have, there was a ton of different models that were looked at. And if you look at across all the different associations, there's all kind of models that people have constructed. One of the things that makes NASW unique is that we have the chapter model. There are many associations where there's only a national and there's no chapter to join. There's some associations where you join the, like I'm thinking of the psychiatrists, you join the national, you pay dues, then you join the regional, you pay dues, and then you join the local and you pay dues. Well, you've got to join the national first, and then you got to join the regional, and then you got to join the chapter. And a lot of associations, like the mental health counselors, for example, you can pay the national dues, and you can opt out of the chapter dues if you want to. So there's all kind of different iterations and variations on the theme. We feel like one of the things that makes us unique is our chapter footprint, that we've got a chapter in each state, and that we've got either, whether it's the board or the local executive director, they become the face of NASW. For a lot of people, that chapter executive, that's NASW to them. So we said we got to preserve that, because that's what's unique about us. And when we have funders like the Hartford Foundation or New York Community Trust or Robert Wood Johnson, any of these funders that come to us, one of the things that make them interested about potentially giving us a grant award dollars is the fact that we have the chapters, and it's a natural kind of delivery system we have. So the thought is we want to preserve the chapters. And one of the things I think that was a commitment was that we know that not every chapter could be self-sustaining. Maybe given the size of a state, like pick on Wyoming, if you're in Wyoming and you can only generate so many members, that you shouldn't be penalized. And the other thing we wanted to be able to say, well, if you're going to pay, you know, $200, $230, or $150, or $78 for your membership, that membership, you ought to be getting the, whether you're sitting in New Jersey or Delaware or Wyoming or New Mexico, you ought to be getting the same value for the money you're paying. And right now what we have is variation. And I've talked to social workers who've been in different states and been members of different chapters, and they said, well, I said, this chapter was great. We had all these resources and benefits and all these things going on. And I went over here, it was barely anything going on. So one of the things we want to do is create more kind of equity, and that's not by taking the good ones and bringing them down. It's like taking the whole and moving the whole curve this direction, so we can actually, so the benefits of membership, so all the members can fully, you know, realize the benefits of membership. And we're doing things to enhance the professional development offerings. We're working on something called, I guess I'll say it, it's not up and running yet, something called NASW-TV. And we actually have tested it, so I know it's going to work, where we can have, you know, we have filmmakers who are social workers. They have a venue for their films. We have any number of webinars and seminars that can be posted on NASW-TV. It would be a venue. And we're, you know, for instance, I was at the Institute of Medicine and the National Sciences. We could simulcast from those settings through NASW-TV. So there's a lot we could do there. We're making changes to our website, major changes to our information technology. We're going to be creating something called My NASW Portal. So folks can go into there and customize. So you can go to our website, the things you like. When you go to your portal, those things will self-populate. Because I know I've had the experience, I go to the website and I'm looking for something and it's not in the same place it used to. It's like someone moved it. It's like, who, you know, how am I going to find it? Well, this will be, you can sort of customize, and then when you go to something, the things you like are there, and then if you see other things, you can kind of add them to your favorites and have your My NASW portal. We're doing things, I don't know, how many of you have heard of Smart Briefs? Have you received Smart Briefs? Okay. Well, if you're a member, you should sign up for Smart Briefs. Actually, you don't even have to be a member to get Smart Briefs, but you should go to our web, you should sign up for Smart Briefs, because it's basically on a daily basis, you get an email and it tells you the most relevant, pertinent, cutting-edge things that are going on in social work. So it's one way to be on the cutting edge, Smart Briefs. We launched that back in May. In May, we had what we call a virtual job fair. We actually brought on a new director of professional development about a year ago so we could really enhance our professional development offerings, because we believe our job is to help you do your job better and to also help advance your career over time. And the professional development is a way to do that. So we want to offer the best sort of continuing education opportunities as possible. We did something called a virtual job fair. Don't ask me how it works, but we had 1,400 folks looking for jobs, 22 employers, and they were able to hook up virtually. For instance, our friends at the VA, they hired a number of people right on the spot. And they had two of the VA locations that were looking to fill positions for a long time, unable to fill those positions, and they filled all their positions during that virtual job fair. And made offers were accepted right there on the spot. And a number of employers have been calling us saying, when's your next virtual job fair? We want to sign up for it. And we're looking to get more and more employers and more folks there, a way of connecting people to jobs, connecting people to promotions, and connecting employers to the workforce. I mean, there are a lot of parts of the country and different industries where people are really hurting for workforce, trying to find people, trying to retain people. So we're doing work there to help in that area. I talked a little bit about our professional development and the things we're doing on the federal reimbursement side. Student loans. We are doing work there in the area of loan forgiveness, and actually our partner, the Council of Social Work Education, they're taking more of a lead role in this than NASW, but we're working right there with them on that. We were part, this is probably about a year ago now, of a student loan forgiveness, a series of meetings over at the White House. So we're working on it. I sort of can't report back. Like, I know part of the question was, when can we expect, is it going to be done, like in your lifetime, or soon enough to help? I mean, obviously there are places now where there's through HRSA or other sort of federal or state agencies where if you make a commitment to particularly in underserved areas, to work for X number of years, you can get your loan forgiveness through that way. Another thing we're doing is working to get more scholarships. And obviously scholarships aren't the answer, because we could double or triple the number of scholarships we have available, and that only is a drop in the bucket, but we are working to get more scholarships available. For instance, we got a grant through the through New York Community Trust. It's a joint effort through the NASW and the Council of Social Work Education, where we're able to give scholarships out, I think about 40 a year over the course of 5 years. And it's really and we modestly call this program Social Work Heals. And don't ask me what HEALS stands for, but basically encouraging social workers to consider careers in healthcare. And these scholarships are available at the bachelor's level, master's level, PhD level, and postdoc level. And the postdoc around research fellowships and policy fellowships. And then there's a national network. There's like 10 schools that were picked to participate in this program. And then there's a national network, and over time, we'll have about 300-400 folks who go through this program, and then there'll be colleagues and peers that can support each other. There was a question about engaging racism, and I think I spoke a little bit about the undoing racism. And I think I think one of the things all of us can do is to encourage discussion about issues of race at a real level and part of it's for understanding, and then part of it's for pushing the envelope, and part of it's for some account of holding the systems accountable, and taking some of these discussions to places we might not typically have, and we can get more comfortable in basically saying, we have institutions where we're not getting the kind of outcomes we want. What's with that? And then we start unpacking it and begin to say, well, there's some bias there. Let's be honest about the bias, and so let's be able to address it. Or let's be honest about the resistance, to where we can unpack it. And it's, we think about the pillars of slavery, the pillars of Jim Crow, and the pillar of, there's no reason why the racism we're we're experiencing today can't be another pillar that comes down. And part of it is having that collective voice that just keeps pushing it and keeps, agitating and saying, now's the time for change. Let me kind of pause and see if there's questions. I don't know if I hit everything, or if some of these things you might want me to go into a little bit more. Oh, you've got some questions?
So now's the opportunity for all of us to have a question and answer session. We had, questions given to us, via email, so, we're gonna flip flop back and forth. So we start
Okay,
with
cool.
someone that's read, and then the audience. So the very first question via email says, it reads, I understand that the NASW has lobbied with the Supreme Court on the rulings respecting those of same-sex marriages. Can you tell us a little bit more about that?
No. I can't say that we filed an amicus brief supporting marriage equity. I can't say that NASW was one of the early sign-ons, basically saying that we should have marriage equality, that a person should not be discriminated against because of the person who they happen to love. So we have been there. I can tell you that when the Supreme Court decision came down, we were actually right in the middle of a board meeting, a national board meeting, and two of our board members said, you know what, I have to be there when the decision comes down. We're gonna go over to the Supreme Court. And they were going for a couple hours, and they came back, jubilant, saying, hey, it passed. So we were there supporting. I can't tell you the specifics. And for instance, our executive director in Rhode Island, every year for about 5 years, he did a bike ride. I think 100, maybe it wasn't 100 miles, it could have been 20 miles, but it was a long bike ride, really advocating for marriage equality and trying to get it passed in Rhode Island. And when, if you think about the first state to pass marriage equality, Massachusetts, there were NASW chapter was prominently involved in helping advocate for that. So.
Okay.
PACE? No, PACE is the NASW Political Action PAC. It is the arm that allows us to support folks who are running for office. And there's all these laws and regulations governing who can and under what conditions you can make contributions to candidates. And PACE is our way of being able to make those contributions. And the requirement is that only members can contribute to PACE, and it has to be a voluntary decision to make. Like, for instance, you couldn't build that into the due structure. That's why you see on the membership form there's a checkoff box. The checkoff say yes, I want to make a contribution to PACE. And actually, over the last 5 years, the PACE contributions have actually been going down. I think we're about 20% lower than what they had been. And it's really our opportunity to support the candidates, whether it be at a local level or a national level, candidates that whose values align with ours. I mean, for instance, Elizabeth Warren, when she was running for Senate, one of her stops was to come over to NASW and spend time at NASW, and we were able to make a contribution to Elizabeth Warren, and we were able to make contributions to local candidates. And we're always encouraging social workers actually, social workers are a natural fit for office, and more social workers should run for office. If you think about constituent work, what is constituent work other than casework? When you think about working across the aisles. What's involved there? We're relationship building. When you think about trying to figure out what should go into a bill, what's there about assessing what the problems are and then coming up with a treatment plan to fix it. And I've met a number of the social workers, whether they're in state legislatures or on Capitol Hill. And for instance, Kristen Cinema from Arizona, who's a very dynamic person. She talks about, how she uses her MSW skills every day within the House of Representatives. And she only hires MSWs in her office. She says, social workers have the skills that are needed to run that office. And one day, and I gotta get myself organized to do it, when I make my trips on Capitol, one of the things I'm gonna say to do you have a social worker on staff? If you don't have at least one of your staff as a social worker, you don't have a full complement of people. Because, they all have an attorney, and all that constituent work, you need a social worker on your staff. So that's PACE. One thing someone asked about shortages of mental health therapists. Yes, there's a prediction there's going to be a shortage. I think there was an article, I don't know if it was in the New York Times recently, about a shortage of psychiatrists. Well, we've had shortages of psychiatrists for a long, long time. You think about the Northeast, places like New York and Connecticut, Massachusetts, Maryland, where we've got the per capita number of psychiatrists are much greater than there are other parts of the country. We still don't have enough access to psychiatry. One of the programs that was created in Massachusetts is something called MACPAP. It basically was a program, it was like 50%, if you take kids, 50% of the kids' psychiatric medications were being subscribed by pediatricians, 50%. With no consultation at all with a behavioral health therapist. So MACPAP was set up to where, and it was set up about 12 years ago, where a primary care clinic, a pediatrician could call this number and get access to a behavioral health clinician who could give real-time, on-the-spot consultation to help them manage behavioral health issue. And that program was so successful, and it's continuing to be so successful, it's been replicated now in 30 states. And it's a way of extending, and in some of these instances, a behavioral health clinician has prescribed days where they're on site within the primary care clinic to offer it on site. And it's also been so significant that the creators of this model are now moving it into a postpartum depression, because that's another underserved group where there's not appropriate access to behavioral health care. So yes, there is a shortage, and one of the sort of things we're doing to help justify this legislation we're filing around raising the reimbursement rate for clinical social workers is saying there's a shortage of clinicians. We want to encourage more clinical social workers to stay in the mental health field providing services and encourage more to come into this field. And one of the ways to do that encouragement is to increase those reimbursement rates, because we know there's going to be shortages over time.
At this time, we have time for one more question. Does anybody in the audience have one? You mentioned that you spoke with someone who was the head of the,
You had mentioned that you spoke with someone who was the head of the physician's assistants. Yeah. I wonder if that social worker actually was a physician's assistant who became a social worker to advocate for their needs, as opposed to being someone, with a social work degree who had that seat. I mean, I think there's a difference. I know that.
Well, and basically, and I had a couple other discussions. In the last 24 hours, I have a couple other discussions with some other folks in the center. There's actually, that's not unique. When you look at physician assistant programs, that there's been a relationship between social work and physician assistants, and it's not unusual to see a social worker who's been trained as a social worker heading up a physician assistance program. Because I think your question was whether that person trained as a physician assistant and then got an MSW, or vice versa. The answer is no. The person's, their credential is the MSW. But there's, and it was interesting because I was like saying, you know, sometimes we feel like only a social worker can do X, Y, or Z, or only a social worker can represent us. So I'm interested in what's that dynamic when this profession is saying it's okay for a social worker to be at the head and representing us. And he said, well, basically, they're looking at, well, do you have the skill set? And partly what happened was, you know, she'd worked in medical settings for over a long period of time and had built up that skill set and that trust.
Thank you. Can we give Dr. McClain a round of applause for coming out and
Thank you.
My pleasure.
Thank you. Okay. I just want to thank Dr. McClain one more time on behalf of the NASW Delaware. We really appreciate his thoughtful words. And that's, so at this time, we're going to end this phase of the meeting, and we have some refreshments over here on the table. So please help yourself. There's fruit and vegetables, and you can make yourself a little sandwich or all that kind of stuff. All right. Thank you. Yeah. Oh, yes, and if the board members could quickly grab whatever they're going to grab and make their way over to the Price Building, room 215, that would be excellent. Thank you.